Her name was Ruth. She was 79 years old. She died on September 3, 2026, from septic shock after Medicare Advantage denied intravenous antibiotics for a kidney infection that spread to her bloodstream. She was buried on September 9th. On September 14th, 11 days after she died, Medicare Advantage automatically withdrew her monthly premium of $487.63 directly from her bank account. They took money from a dead woman's account. They charged a corpse for health insurance coverage. And when her family demanded a refund, the insurance company refused. They said the premium was for September coverage, even though Ruth had been dead since the 3rd day of that month. This is not a mistake. This is not a computer glitch. This is standard practice for Medicare Advantage plans in 2026. Ruth had been a nurse for 43 years. She worked in labor and delivery at the same hospital from 1965 until she retired in 2008. She delivered thousands of babies. She held the hands of terrified first-time mothers. She stayed late when her shift ended, but a delivery was still in progress. She never wanted anyone to go through labor without a familiar face in the room. After she retired, she volunteered at a free clinic twice a week. She taught prenatal classes for low-income mothers. She was the kind of nurse who actually cared, who saw patients as people, not problems to solve before the shift ended. Ruth enrolled in Medicare when she turned 65 in 2012. For the first few years, she had traditional Medicare with a supplemental plan. Then in 2022, she got a call from an insurance broker. He told her about Medicare Advantage. Lower premiums, better coverage, dental and vision included. It sounded good. Her supplemental plan was costing her over $200 a month. The Medicare Advantage plan he was selling cost $147 monthly. She'd save money. She signed up. What the broker didn't explain clearly was that Medicare Advantage plans are run by private insurance companies. They're not the same as traditional Medicare. They have provider networks. They require prior authorizations. They can deny care that traditional Medicare would cover. Ruth didn't understand the difference until it was too late. For the first few years, Ruth didn't have many health problems. Some high blood pressure, high cholesterol, arthritis in her knees. Routine stuff for someone in her 70s. Her medications were covered. Her annual checkups were covered. She didn't have any major issues with the plan. Then in August of 2026, she developed a urinary tract infection, common in older women, usually easy to treat with oral antibiotics. Her doctor prescribed a standard antibiotic. Ruth took it as directed, but the infection didn't clear. It got worse. By late August, Ruth was running a fever. She was confused. She couldn't keep food down. Her daughter took her to the emergency room. The ER doctor ran tests. Ruth's white blood cell count was elevated. Her blood cultures came back positive for bacteria. The UTI had spread to her kidneys and then to her bloodstream. She had sepsis. Sepsis is a life-threatening condition where the body's response to infection causes organ damage. It requires immediate, aggressive treatment with intravenous antibiotics. The ER doctor admitted Ruth to the hospital and started 4 antibiotics right away. Ruth responded well initially. After 2 days of 4 antibiotics, her fever came down. Her confusion cleared. Her lab work started improving. The infectious disease specialist recommended a full 14-day course of 4 antibiotics to make sure the infection was completely cleared. After 5 days in the hospital, Ruth was stable enough to go home with a PICC line, which is a special 4 catheter that stays in place, so patients can receive 4 medications at home. The hospital arranged for home health nursing to come daily to administer the antibiotics. This is standard care for serious infections that require prolonged treatment. The home health agency submitted a prior authorization request to Ruth S. Medicare Advantage plan for the home 4 antibiotic therapy. The authorization was needed to cover the cost of the medication, the nursing visits, and the PICC line maintenance. The request included all of Ruth's hospital records, the infectious disease consultant's notes, the discharge summary, and the treatment plan. Everything documented that Ruth had bacteremia from a kidney infection and required 14 days of 4 antibiotics per standard infectious disease protocols. The denial came back in 72 hours. The reason given was not medically necessary. Patient can be treated with oral antibiotics. Ruth's infectious disease doctor called the insurance company. He explained that Ruth had already failed oral antibiotics. That's why she ended up septic in the hospital. The bacteria causing her infection was resistant to oral medications. She needed 4 antibiotics. The medical reviewer said Ruth could try a different oral antibiotic first. The doctor explained there was no oral antibiotic that would work for this particular bacteria. The culture and sensitivity testing showed it was only susceptible to IV medications. The reviewer said to submit an appeal with the culture results. The appeal was submitted the same day. It was denied again within 48 hours. This time the reason was inpatient treatment more appropriate. The insurance company's position was that if Ruth needed IV antibiotics, she should stay in the hospital rather than receive them at home. Ruth's doctor explained that keeping patients in the hospital for 2 weeks of 4 antibiotics when they are otherwise stable is not appropriate. It exposes them to hospital-acquired infections. It's more expensive than home therapy, and it's not the standard of care. Home 4 therapy exists specifically for patients like Ruth who need 4 medications but do not need to be hospitalized. The insurance company wouldn't budge. Ruth's daughter asked how much the Home 4 therapy would cost if they paid out of pocket. The home health agency gave her an estimate. The medication alone was $8,000 for the 14-day course. The nursing visits were $250 per day. The PICC line supplies were another $1,500. Total cost was approximately $12,000. Ruth had $3,000 in savings. Her Social Security was $1,800 a month. Her pension was $900. She lived on $2,700 a month. She paid rent, utilities, food, medications, and insurance premiums out of that. She had nothing extra. Her daughter was a single mother working as a medical assistant. She didn't have $12,000. Ruth's PICC line was removed. She was sent home with oral antibiotics, even though the testing showed they wouldn't work. Within 3 days, her fever came back. She became confused again. She stopped eating. Her daughter called the doctor. He said to bring her back to the emergency room. Ruth refused. She said she couldn't afford another hospital stay. She was scared of the bills. Her daughter didn't know what to do. She gave Ruth the oral antibiotics and hoped they would somehow work, even though the doctors said they wouldn't. September 1st. Ruth was too weak to get out of bed. Her daughter called 911. Ruth was admitted to the hospital again. The infection had spread. She was in septic shock. Her blood pressure was dangerously low. Her kidneys were failing. The hospital team started aggressive treatment with 4 fluids, vasopressor medications to support her blood pressure, and broad-spectrum 4 antibiotics. But her body had been fighting the infection without adequate treatment for too long. Her organs started shutting down. September 3rd, at 2:17 in the morning, Ruth died. The death certificate listed the cause of death as septic shock due to multi-drug-resistant pyelonephritis. Pyelonephritis is a kidney infection. Ruth's daughter was devastated. She'd watched her mother die from an infection that should have been treatable. If the 4 antibiotics had been approved when they were first prescribed, Ruth would likely have recovered. Instead, she spent 10 days getting inadequate treatment while the infection ravaged her body. On September 3rd, the same day Ruth died, her daughter called the Medicare Advantage plan to report the death. She spoke with a customer service representative who expressed condolences, and said they would need an official death certificate to close the account. The representative said to send it when the family received it. Ruth's funeral was on September 9th. The funeral home handled the arrangements. They told the family that the official death certificate would be filed with the state and copies would be available in approximately 2 weeks. That's standard. Death certificates go through a process. The funeral home submits the information. The state processes it. Then certified copies become available. In the meantime, the family had a copy of the funeral home's statement of death, but not the official certified death certificate that institutions require. September 14th. Ruth's daughter was going through her mother's mail and bank statements, trying to get her affairs in order. She noticed a withdrawal from Ruth's checking account dated September 14th, $487.63. The Medicare Advantage monthly premium. Automatic withdrawal. Ruth had been dead for 11 days. She'd been buried for 5 days. And the insurance company had just charged her for another month of coverage. Ruth's daughter called the bank. They confirmed the withdrawal. It was an automatic payment that Ruth had set up when she enrolled in the plan. The bank said they couldn't stop it without authorization from the account holder. Ruth's daughter explained that the account holder was dead. The bank said they would need a death certificate to freeze the account. She said she'd sent one to the insurance company. The bank said that that wasn't sufficient. Each institution needed its own certified copy. She asked if they could reverse the charge. The bank said she'd need to request that from the insurance company. She called the Medicare Advantage plan. She explained the situation. Her mother had died on September 3rd. She'd called and reported the death that same day. Why did they charge the premium on September 14th? The representative pulled up the account. She said the death had been noted in the system, but without an official death certificate, the account remained active. Active accounts are charged premiums. Ruth's daughter said her mother was dead. The representative said she understood, but policy required a certified death certificate before premium charges could be stopped. Ruth's daughter asked for a refund. The representative said that wasn't possible. The premium was for September coverage. Even though Ruth died on September 3rd, she had coverage for those 3 days, so the full month's premium was owed. Ruth's daughter couldn't believe what she was hearing. They were charging her dead mother for 27 days of health insurance coverage after she was already dead. The representative said that that was the policy. Premiums are charged monthly. If a member dies during the month, the premium for that month is still charged. Ruth's daughter asked to speak to a supervisor. She was transferred. She explained everything again. The supervisor said the same thing. Without a death certificate, they couldn't close the account. And even with a death certificate, they wouldn't refund the September premium because Ruth had coverage for part of September. Ruth's daughter asked if they were seriously going to keep money charged to a dead woman. The supervisor said she understood the daughter's frustration, but the policy was clear. 2 weeks later, the certified death certificates arrived. Ruth's daughter sent copies to everyone: the bank, the insurance company, Social Security, the pension fund, all the institutions that needed official proof of death. October 14th arrived. Another premium was withdrawn from Ruth's account: $487.63. Ruth had been dead for 41 days. The insurance company charged her again. Ruth's daughter called immediately. She'd sent the death certificate. Why was another premium charged? The representative checked the account. She said the death certificate had been received and the account was now closed. But it was closed effective October 1st, which meant the October premium was still charged. Ruth's daughter asked how an account could be closed on October 1st, but still charge a premium on October 14th. The representative said the premium for October was owed because the account was active for part of October, even though the only thing that happened in October was them processing the closure. Ruth's daughter demanded both premiums be refunded. September and October. A total of $975.26 charged to a dead woman. The representative said she'd submit a request to the billing department. It would take 4 to 6 weeks to process. Ruth's daughter asked what happened to all the other families going through this. The representative was quiet for a moment. Then she said this happened frequently. Families often don't have death certificates immediately. The automatic payments continue until the certificates are received and processed. And no, refunds are not typically granted because the policy considers any part of a month as a full month of coverage. This is not unique to Ruth's case. This is not one insurance company with bad policies. This is standard practice across Medicare Advantage plans. When a member dies, the automatic premium withdrawals continue until a certified death certificate is received and processed. That can take weeks. During that time, multiple premiums may be charged, and insurance companies routinely refuse to refund those premiums, claiming that coverage existed for part of those months, even though the member was dead. Traditional Medicare doesn't work this way. Traditional Medicare Part B premiums are deducted from Social Security checks. When Social Security is notified of a death, the benefits stop, and so do the premium deductions. Any overpayment is typically refunded to the estate. But Medicare Advantage plans are private insurance. They set their own billing policies. And those policies prioritize revenue over compassion. Thousands of families every year deal with this same situation. A loved one dies. They notify the insurance company. They're told they need a death certificate. They wait for the death certificate to be processed. Meanwhile, monthly premiums keep being withdrawn. When they finally send the death certificate, they're told the premiums won't be refunded. They're charged for coverage that a dead person couldn't possibly use. And there's almost nothing they can do about it. Some states have laws requiring refunds of premiums charged after death. But enforcement is weak. Insurance companies know most families won't fight over a few $100s when they're grieving. They know most people don't have the time or energy to file complaints with state insurance commissioners. They know they can get away with it. So they do. Ruth's daughter eventually filed a complaint with her state insurance department. 6 months later, she received a letter saying the insurance company had agreed to refund the October premium, but not the September premium. $487.63 returned. $487.63 kept. Her mother had been charged $975 for health insurance after she was dead, and the insurance company kept half of it. If your parent, your spouse, anyone you love has Medicare Advantage with automatic premium payments, you need to know this happens. When they die, call the insurance company immediately. Request in writing that all automatic payments be stopped. Don't wait for the death certificate. Send whatever documentation you have. Send the funeral home statement. Send the obituary. Send anything that proves the death occurred. Follow up in writing. Document every call. Keep records of every withdrawal. If premiums are charged after death, demand refunds immediately. File complaints with your state insurance commissioner. Make noise. These practices need to be exposed. Every family charged premiums for a dead loved one. Every refund request denied. Every insurance company that treats death as a billing inconvenience rather than the end of coverage. Share these experiences. Demand accountability. Demand legislative action. This is preventable. Ruth died because her treatment was denied. Then she was charged for insurance coverage while lying in a casket. This is what happens when profit matters more than people. This is what happens when private companies are allowed to manage Medicare with minimal oversight. This is Ruth's story, and right now, another family is discovering that their dead mother's account was charged again this month.